Today we'll be talking about causes of infertility in women. Do you know that there are three types of infertility? There is the primary infertility, the secondary infertility, unexplained infertility. In the primary infertility, in this situation, the woman has not been pregnant before, even after 12 months of having unprotected sexual intercourse. In secondary infertility, this woman has been able to give birth to one child, and after that, nothing else. Her fertility ceases. She's not getting pregnant again. And in unexplained infertility, this is a situation whereby the couples have all gone for tests. The husband has been tested, the wife has been tested, and nothing was seen. And in this situation, this type of infertility resolves on its own. Hello everyone, welcome to my page and you're welcome to Blissful Life. My name is Priska. So like I said, today we'll be talking about infertility in women. And infertility in a woman can arise as a problem affecting her uterus, the fallopian tubes, and the ovaries. So one step at a time. Now for problems affecting the ovaries, number one is ovulation disorders. In ovulation disorders, this is a situation whereby a woman ovulates infrequently or she does not ovulate at all. And what are the conditions that can make a woman to ovulate infrequently or make a woman not ovulate at all? Number one is the polycystic ovarian syndrome or the PCOS. The PCOS aims at a woman's ovulation. It is a hormonal imbalance. And how do you know that you have polycystic ovarian syndrome? Number one is overweight. You will be gaining weight. You would have insulin resistance. That is, your blood sugar will be high. Number three is abnormal hair all over your body. You have facial hair. You will be growing hair on your face, on your chest, and on your back. You see, so abnormal hair growths. And then another one is acne. So when you have all these symptoms, when you have one or more of these symptoms, you need to go to the doctor and check yourself and see if you've got PCOS. Another condition that can affect ovulation is the primary ovarian insufficiency or the premature ovarian failure. In primary ovarian insufficiency, it's caused as a result of premature loss of egg from the ovaries, and this is as a result of genetics or chemotherapy. Another condition that can affect ovulation is when you have too much prolactin in the body. That's hyperprolactinemia. It's a situation whereby you're not pregnant, you're not breastfeeding, but you notice that you are having breast milk discharge from your breasts. This can inhibit ovulation, thereby resulting to infertility. So having talked about problems affecting ovulation, let's talk about the fallopian tubes. There are problems that can affect the fallopian tube, thereby leading to infertility. In a situation whereby the fallopian tube is damaged or it is blocked, this can affect fertility because the sperm cannot go over to fertilize the egg, or the fertilized egg cannot travel down to the uterus for implantation. So what are the conditions that can lead to a blocked or damaged fallopian tube? Number one is pelvic inflammatory disease, PID. If you have not watched my video on PID, please do well to watch it. So PID is caused by sexually transmitted infections like the chlamydia and the gonorrhea. So without treating it properly, it can damage the fallopian tubes. Another one is when you've done a surgery in the pelvis, especially when you have ectopic pregnancy and you've done a surgery in the pelvis, it can damage or it can block the fallopian tubes. Okay, so having talked about problems affecting the fallopian tubes, let us talk about the problems affecting the uterus, which can cause infertility. Number one is the endometriosis. There's a condition called endometriosis. This is a condition whereby similar linings that are supposed to be in the uterus start growing elsewhere. That is, the tissues that are supposed to form a woman's uterus starts to grow somewhere else, like on the fallopian tube and on the ovaries. Of course, when you have such a condition, it will be very difficult to get pregnant. Okay. Another problem affecting the uterus, of course, we all know, is the fibroids. Fibroid can lead to infertility. There are people who are born with abnormal shape of the uterus from birth. They have abnormal shape of uterus or womb. This can affect their fertility. And then there is another problem affecting the cervix, because when there is narrowing of the cervix, when your cervix is very narrow, when the cervix is narrow, it prevents sperm from swimming up to meet the egg that was released, thereby leading to infertility. Again, the condition of the cervix also plays a very huge role in fertility, because if your cervical mucus, if your cervix is very hostile to sperm, it kills the sperm, thereby causing infertility in a woman. Now, what are the risk factors? What can predispose a woman to being infertile? Number one is age. Of course, we all know that as one advances in age, her chances of fertility begins to drop. Number two is extreme stress. When a woman is under extreme stress, it can affect her fertility. It can lead to infertility. Number three is overweight. When you are overweight or when you are extremely thin, it can affect fertility as well. Also, substance abuse like smoking, drinking heavily, using drugs, it can affect your rate of fertility, or it can make a woman to be infertile. Now, if you have any concerns, you have to meet a gynecologist, because it is a gynecologist that takes care of anything that has to do with the female body. In as much as I know that when a woman is trying to achieve pregnancy, it is a very difficult moment for them, because the woman can be depressed, the woman can feel grief, they can even blame themselves. Okay, it is no one's fault. It is not your fault. Things happen. All right, so sometimes it happens that way. And with the proper treatment, with your compliance, the treatment for infertility yields positive results, because most people become pregnant, they have their own children, they have their own family, they become happy. Okay, so when you go for treatment and an option is being given to you, you have to try to cooperate so as to be able to have your own child. So for the treatment, it depends on what is causing the infertility. If it's hormonal problems, then you have to take some medications to help to correct the hormonal issues, so that you can be able to have your children. Also, there are some people, like people that's got blockage somewhere, the blocked fallopian tubes, can undergo surgery. Okay, they can undergo surgery as well to have their own kids. And then the IVF is also another way of getting your own kids, another way of getting your own children. All right, so all this is a basic knowledge, all this is just general knowledge, something we know. So if you're happy with this video, do not forget to like and share, and also subscribe to my YouTube channel. Thank you so much, and I will see you in my next video. Bye.